In 2025, there will be over 20,000 new cases of prostate cancer diagnosed this year in Australia. Here in New Zealand, where this video is being recorded, there will be approximately 4,000 new cases in a population of around 5 million people. In the United States, with a population of over 350 million people, there are over 300,000 new cases of prostate cancer every year. Approximately 1 in 8 men will develop a significant prostate cancer at some stage in their life. In this video, I'd like to explain and highlight for you some of the risk factors that increase a man's risk of developing prostate cancer at some stage in his life. For those of you that are new to the channel, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic located on the Gold Coast in Australia. As always, if you get benefit from the video, please give it a thumbs up, share the video, or subscribe to the channel. Okay, let's get into it. The most significant risk factor for the development of prostate cancer is age. In my clinical practice over the last 20 years as a urologist, the probability of seeing or diagnosing a man with prostate cancer in his 30s is exceedingly rare, and I've seen only 2 cases in that duration. It becomes slightly more common in men in their 40s, but it's still exceedingly rare. The majority of prostate cancers, some 60% of prostate cancers, actually occur in men over the age of 65. So age is a significant risk factor for the development of prostate cancer. Let's look at factor number 2 now, which is family history. And so if there is a first-degree relative in your family, i.e. father, brother, it significantly increases your lifetime risk of developing prostate cancer. So as I said, a man's lifetime risk of developing the disease is around 1 in 7 to 1 in 8. If there's one first-degree relative, then that risk will go to 1 in 3. If there are 2 first-degree relatives, that risk goes to 1 in 2. And if there are 3 or more, it's as close to certain as possible that you or that man have a risk of developing a significant prostate cancer at some stage in his life. On a quick aside, if you have a question related to your prostate symptoms, or prostate cancer, please follow the link in the description down below and sign up for our live event, which is happening Thursday, the 28th of September, this coming Thursday, the 28th of September at 8 p.m. Australian Eastern Standard Time. If you have a question, please join up the session and you can ask your question and we'll go through your questions one by one at that time. All right, let's get back to the video. There are some genetic mutations which have been associated with a significant increased risk of the development of prostate cancer. These include BRCA1 and BRCA2 gene mutations. These are also associated with an increased risk of breast cancer. So if you are a member of a family where there does appear to be an increased risk, or more people have been affected with either breast cancer or prostate cancer, please go and have a discussion with your local doctor to try and work out if you are an affected family for any of these genetic mutations. Ethnicity also plays a significant role in the potential development of prostate cancers. In fact, African Americans are 60% more likely to develop significant prostate cancer than their Caucasian counterparts. Hispanic or Asian men are less likely to develop the disease. Moreover, African Americans are more likely to develop prostate cancer which is more aggressive and are more prone to develop this disease at an earlier age than Caucasian counterparts. The final category relates to diet and lifestyle, and some studies have highlighted that a poor diet can actually increase the probability of being diagnosed with a significant prostate cancer. So what is a poor diet? Well, diets that are high in saturated fat and red meat. Some studies have highlighted that men who have a higher consumption of red meat and dairy which do contain obviously animal protein and high concentrations of saturated fat, are at an increased risk of developing prostate cancer and also a more aggressive prostate cancer. One of the challenges that we have with looking at diets and the specific association with the development of certain conditions is it is quite hard to really prove in a concrete way an association between what's consumed and the risk of developing a certain condition down the line. But with the evidence that we do have, it does appear that diets that are high in saturated fat, i.e. those in particular that have a high consumption of dairy and red meat, does increase the risk that someone can be diagnosed with a prostate cancer at some stage in their life. The consumption of fruits and vegetables, particularly those fruits and vegetables that contain a lot of lycopenes, have been associated with a potential reduction in the risk of developing prostate cancer. The other aspect really is vitamin D, and in those individuals who consume or have higher vitamin D levels, they can be associated with a lower risk of developing significant prostate cancer. So when you're looking at your lifestyle factors and your particular exposure, one of the key factors, in my opinion, really is to look at your genetic predisposition and have a look at your lifestyle and try and work out how you might be able to juggle around lifestyle factors to try to reduce your lifetime risk of developing prostate cancer. Some studies have shown that men with high-fat diets have a 10 to 20% higher risk of developing prostate cancer when compared to men who have a lower-fat diet. And in fact, the American Cancer Society does recommend having a lower-fat diet, which is rich in fruit and vegetables, and that this can facilitate not also maintaining a healthy weight, but reducing your probability of developing prostate cancer as well as other cancers in your lifetime. Why it all matters, really a healthy lifestyle which involves resistive exercises or lifting weights, and also doing some aerobic work, which can be something as simple as going for a walk on a daily basis, a swim, a bike ride, or really whatever you can manage, in conjunction with consuming an appropriate diet, really do have the potential for reducing your risk of developing further cancers in due course. If you're unsure about your risk of developing prostate cancer, or you'd like to have a discussion further, please reach out to your local doctor and have that discussion. Until the next time, please take care of your prostate. If you'd like to know more about prostate aspects, please have a look at this video, or alternatively, this video here.